Hi, my name is Don Schumacher and I'm president of the National Hospice and Palliative Care Organization. We're here today to talk with you about hospice care. Now, some of you may have had experience with hospice care, some of you may know or have had experience with palliative care. Palliative care is the provision of good comprehensive pain and symptom management to patients who are facing serious or terminal illness. Today we're going to be focusing on hospice care, which is the largest provider of palliative care in this country. About 1.5 million people receive hospice care over the course of about a year. During that time period, Americans such as yourselves probably have received the news that the illness that they were being treated for has not been moved towards a curative phase of their illness, but in fact has become terminally ill. If yourself or your loved one has received this news from their physician and they've made a choice or a decision to move towards a more thoughtful, palliative, supportive model rather than curative treatment. The focus is on care, not cure, and the object of hospice care is to provide to that patient and the family enough support to allow the process of dying to take place in as comfortable a setting as possible. Care is also highly identified as being connected to the family as well, because all patients, as they're going through the process of dying, do need to have the love, support, and care of their family members or loved ones. So for hospice as a provider of services, the patient and the family are defined as the unit of care. So what I'm going to share with you are, first, definitions of hospice care, the types of hospice care and when to begin preparing for it, how hospice care is paid for, how you would go about choosing a hospice in your community, and how you might prepare yourself and your family for the entry into hospice programs. Because even though this is a sad and sometimes difficult issue, it's very, very important that you have enough advanced knowledge and advanced warning, advanced preparation, so that before you are admitted to hospice services, you have enough information and know when to make that call. Before we begin, let me share a little bit with you about our organization. I'm speaking to you today from the National Center for Care at the End of Life here in Alexandria, Virginia. This building houses the National Hospice and Palliative Care Organization, the National Hospice Foundation, FASHA, which is our work in Africa, and the Alliance for Care at the End of Life. These four organizations work in concert to bring awareness, education, public policy, and advocacy to consumers and providers of hospice services all around this country. And now let's get going and looking at what hospice care might mean to you should it come into your life.